The perspectives expressed in this podcast are those of the host and guests. The views expressed are their own and do not necessarily represent the views of the National Institute of Health or the United States government.
Hey, Sickle family. I'm Wumi Bakare.
And I'm Dima Hendricks. And we would like to welcome you to the Through the Genes podcast,
where we talk about living, healing, recovering, and exploring curative therapies for sickle cell disease.
We will also talk about our individual curative therapy journeys and the bond that we built as sickle cell sisters.
Hello, Sickle family, and welcome to a special bonus release from the Through the Genes podcast. As we gear up for season 2, we're excited to bring you 2 powerful bonus episodes that highlight our collaborations with other incredible podcasts in the sickle cell and health equity space. Whether you're tuning in for the first time or you've been here since day one, these episodes are just a glimpse of what's yet to come. So stay tuned and get ready for season 2 of the Through the Genes podcast. Welcome everyone to a very special episode of the Through the Genes podcast. And here we're having a special collaboration with the host of the Let's Talk About Sickle Cell podcast, Jenica, Leah, and Maya Bloomberg. Today we're going to delve into a critical topic, curative therapies for sickle cell beyond the U.S. border, where we're going to compare and contrast the different treatments between Europe and USA. Before we start, could you please introduce yourself?
Sure. So many of you might know me as the Heme NP on social media, but my sickle cell advocacy started over a decade ago. I started my nursing career on a med-surg telefloor, so I took care of countless patients with sickle cell. But in the hospital, you really only see the pain and the anemia. So it's becoming a nurse practitioner is when I realized first that sickle cell encompassed head-to-toe complications and was far beyond just pain and anemia. But the biggest thing is that literally every single patient of mine had a horror story of judgment, mistreatment, whether they were hospitalized every month or every other year, that it was hard to just sit on the sidelines without being an outspoken advocate. Then fast forward, the pandemic happened and there was so much misinformation out there that I noticed was negatively impacting my patients. And many don't know, but I actually went to art school for 8 years. So I'm a very creative person and I never really found a way to blend my artistic side with my nerdiness. So lo and behold, the Heme NP was born, and it kind of was a beautiful marriage that allowed me to use my knack for simplifying complex topics so people can actually understand, and then also use my creative skills. So the Heme NP was born, and it's kind of a dedicated hub just to provide easy, reliable, and understand information so basically patients can be their best advocates, because knowledge is power. Hematology can be really complex. And then my own self-healing journey has ignited a passion for mental health. So I also do some chronic illness support as well.
Jenica, can you tell us a little bit about yourself?
Yes, so my name is Jenica Leah. I'm from the UK, from Birmingham to be specific. I live with sickle cell anemia SS, and I've had everything that comes with that, from numerous different complications, stroke, AVN, and then hip replacements and everything else that comes with it. And I would say I pretty much became a very vocal advocate once I kind of hit my late teens, early 20s. I'm the author of a children's book series, which is called My Friend Jen, which a lot of people know. My Friend Jen, I literally wanted to be able to create something that would give children peace of mind and confidence that I didn't have when I was, a lot younger, growing up with sickle cell, because I really felt like I knew I had something called sickle cell, and I would get sick, I would go to the hospital, and then I would come home. But all of the ins and outs of that, why I would go to hospital, why I shouldn't have done certain things, and all of those things, I didn't really understand. And what I noticed growing up was that younger children that were being born with sickle cell and growing up were literally facing the same experiences that I felt I was facing. So I published the first My Friend Jen book in 2016, and then the second one in 2020. And then from then, My Friend Jen has just kind of become like a household name for sickle cell advocacy. We do events, we have our galas, conferences, and we do lots of different things. So myself personally, I think sharing my experiences with sickle cell is the main thing that I like to do. I have a YouTube series called Conversations with Jen, where I give people the opportunity to share their stories, because I think the more we hear, the more we can almost also like relate to someone else's experiences. And maybe people are going through things that, you know, you feel alone at the time in the moment, but then you go online or you might find someone else that has experienced the same thing. And most of the community is so lovely. We're so friendly. We're always willing to connect and support each other. So I kind of just wanted to open those platforms for others. And yeah, I've kind of just, I don't stop talking basically about sickle cell.
So Jen, thank you for sharing your backstory. And because you're a warrior, we know why you have an interest in this niche area. But back to you, Maya. What sparked your interest in sickle cell disease and research?
Honestly, I say it's divine intervention, because when I was a nurse, becoming a nurse practitioner, I didn't know what I wanted to specialize in. I'm a family nurse practitioner because I'm like, okay, it covers birth to death, so I will figure something out. And when I was in the hospital as a nurse, a bedside nurse, I saw so many doctors just treating patients like numbers. So what was most important to me when I was picking my specialty was the doctor I was working with. I wanted to make sure that they cared about their patients and did not treat patients like numbers. And I turned on a few jobs before, which was very challenging because it was even before I had passed my board exam. But I ran into Dr. Harrington, and anybody who knows him, he is kind of the exception and truly puts the patients first. So I fell into hematology because of the doctor who I was going to be working with. But again, it was all of those horror stories and just realizing how beautiful of a community this is. And we all know that sickle cell, it's been neglected, it's been underserved for so many years. And I felt like if I could use my knowledge and my experience and my connections to kind of help this community and improve the outcomes, that would be a huge impact and a win. So I truly believe it was divine intervention, because it's not like I became a nurse practitioner and decided I want to treat sickle cell. I really fell into it, and sickle cell chose me.
So before we get into curative therapies, I want to know, Jen, you're living in the UK now. What are the treatment options available for individuals in the UK with sickle cell disease?
So similar to, I guess, globally, right? Most of the options that we have focus on kind of just managing the symptoms. So we have hydroxycarbamide, which is like one of the main ones. We also have blood transfusions or blood exchanges. I would say those two, aside from, you know, penicillin and having your regular vaccines and stuff, are the main treatments that are available. And to be honest with you, that is what we have. There is bone marrow or stem cell transplant. It's available. And I guess at the moment, you'd say that's probably one of the only curative treatments we have available. But it's only suitable for a very small number of patients because of the risks involved, and also because they usually only do it if you've got like a direct match from a sibling or someone else. So it's very limited compared to what I know, you know, we've had approved. So we did have marketing approval for CRIS, which we lost back in November of 2021, I think. And L-glutamine, I mean, I don't think that ever officially got approved. So, you know, we're far behind, but we're working on it, I guess.
I guess it differs a little in the United States. So we have everything that you listed. And then in 2017 is when we had our first new sickle cell treatment in over 20 years, which was an Endari, which is high doses of L-glutamate. And then more recently, we have our two FDA-approved gene therapies. And as you mentioned, bone marrow and stem cell transplant as the other curative options. So a little different, but it's a great conversation for us to kind of open up this dialogue, because I think when we talk about the differences in the UK and NHS and the United States and just the approval process, et cetera, it seems like the UK heavily focuses on the cost effectiveness, which is one of the reasons why crizanlizumab was removed, where the United States doesn't necessarily put as much emphasis as opposed to efficacy and safety, and also if they're an orphan drug or accelerated approval, which we'll dive into, I'm sure, deeper in this conversation today.
I love that we're having this conversation. Mennos can predict what I'm about to say next, which is that as a foreigner, I've been treated on 4 different continents, the UK being one of them. And I think until you realize the health disparities that exist outside the US is when you know that there needs to be more collaborations with international community-based organizations and international companies that are represented internationally as well, like, the likes of Pfizer and Vertex that have offices in these regions. Because for me, I will be honest, I know there are disparities in the US, but I think there is a sense of comfort that you get when you know there's more than one option for you. I think when you recognize that the standard of care was hydroxyurea, but now we've evolved past that to curative therapy treatments, it gives you some, as a patient, it almost puts you in a position where you say, there is more than one way to survive with sickle cell disease. But I wanted to ask this because it was until you and I connected where you shared that, because last year when we were all, applauding, it was a historical moment in time that the FDA had finally approved gene therapy. There were news articles that said it was also approved in Europe. And when most people think Europe, the first country that comes to mind is the United Kingdom. And so it wasn't until our conversation where I think the approvals are more like in France and Italy than the UK that I was completely mind boggled, because I was like, well, then that's misinformation. You can't say Europe without Great Britain. So can you talk us through what is the approval process? Do you have an idea of what the approval process is for pharmaceutical companies?
So I think what happens, we have to remember that at one point we were one umbrella, although for kind of medical approvals it was slightly different. But the European have what's called the European Medicines Agency, and that would be similar to like you guys having the FDA in the US. So the European Medicines Agency can approve something, and then that means that throughout Europe, country by country, it can be approved and accessible, etc. Now in the UK, you guys know we have the NHS, which is supposed to provide almost like universal access to care, and it doesn't have a cost. But what that means is the UK has kind of like a two-step approach when it comes to the approval process. So we have what's known as the Medicines and Healthcare Products Regulatory Agency, abbreviated as MHRA. So when we hear in the news that something's been approved, what then happens is we have something that's called the National Institute for Health and Care Excellence, which we call NICE. So NICE then assesses whether those treatments that have been approved by the MHRA are actually cost effective enough and should be available through the NHS because it's free. So even though we get medical approval for treatments, like we've got gene editing and all of these things that have been approved, they haven't actually been effectively assessed by NICE, and therefore they're not yet available. So even though we hear one side of the story, there's such a long process that we have to go through, and it doesn't always prove successful. So whereas gene editing in Europe, I think we've had our first person in France who has been one of the first people to undergo the new gene editing treatment that has been approved. It hasn't been approved in the UK for sickle cell yet. Yesterday it was approved for thalassemia. It's the same umbrella, but it's not been approved for sickle cell. And the reason being is that they don't see that it's cost effective for the impact of the disease. And that basically boils down to, the misunderstanding, the lack of education and awareness of sickle cell and how it impacts people.
Can you walk us through the process, like for a sickle cell disease patient who is diagnosed, let's say as an infant, let's just say for the sake of this conversation, 2 years old, what processes do they go through to determine what disease modifying therapy or treatment option is better for them? Because you mentioned hydrocarbamide, which is a medication that I don't think I've heard before. So can you kind of educate us about what the options would be in helping that sickle cell warrior maintain their health?
Oh, so in the UK, so I think we kind of named the medication differently in the UK versus the US. So hydroxyurea in the UK, we call it hydroxycarbamide, but it's the same medication. So now in the UK, after newborn screening and your child is diagnosed with sickle cell, hydroxyurea is now it's almost compulsory that a child is on some form of treatment, and that usually would begin with hydroxy. And then if they are on hydroxy and they still find themselves having crises and regular hospital admissions, they would then automatically recommend they go on a blood transfusion program, which would be having blood transfusions every 4 to 6 weeks, depending on the sickle levels. So those are the two main things that would be recommended. Now, for the bone marrow stem cell transplant, a child would have to be sick enough and have tried, like Maya was saying, you have to have exhausted all of the efforts on hydroxy and on blood transfusions before they would even have a conversation with you about having a bone marrow transplant. And then it would be down to, do you have a match in your family? Very rarely will they go to the donor register to see if there is a match or something like that. So it's then down to having a direct match of a sibling, which sometimes is very much unlikely. And then there's all the complications and everything that comes with it. So I know it has been done a few times, and it's mostly done in children and not adults. But generally speaking, I feel like for new parents that have a child with sickle cell and they're given hydroxy and they read up on it. Like, if you Google hydroxyurea without doing all your research, if you're not a little geek like myself or like Maya, you automatically see chemo and straight away you don't want to put your child on it. And I think that a lot more, for new moms, a lot more care and consideration has to be put onto this medication. It does show that it helps, it improves quality of life, and it also improves in terms of the long-term organ damage that when you get to the teens and the 20s and your child is going through all of these horrible complications as a result of not having that treatment available. That was my experience, so it is worth balancing these treatments and options up. But I wish we had more choice. And I think like Maya was saying, hopefully the more we have, the more it would eventually bring the cost down. But I think it would be nice to have a choice compared to some other, genetic disorders which affect less people but have more treatments and more medications available. It's just a horrible disparity, and I just think it's really unfair.
So I have a follow-up question to what you were just saying, and it's, please excuse the randomness, but you mentioned newborn screening, and that's something that's required here in the US. Is that also a requirement in the UK?
Yes. So newborn screening is done now across the board in the UK. I think from the late early 90s, it became across the UK, newborn screening is standard. However, people still fall through the cracks. I don't know how. I don't know. I think it's mainly down to, I would say, probably like immigration, and we're having people come over from different countries, from Europe, whatever, and they're coming with children from places where newborn screening is not compulsory. So they're growing up and not knowing that they have sickle cell or not knowing that there's anything wrong, and they're not getting those checks done until when it's almost too late.
It's a good point. I feel like in the past 2 months, actually, I've had 4 patients that I diagnosed with sickle cell, which as an adult provider is rare. 2 of them were in their 30s, one was in their 40s, and one was in their 50s. And it's kind of that they've had anemia their entire life, but it kind of went incognito. But it was always people who emigrated to the United States late. And then all of a sudden they're getting this diagnosis. And it's always surprising to me where I have to kind of go over the Sickle Cell 101 and intro to the basics. But it's a good point. Yeah.
It's just interesting how sickle cell is so nuanced. There's so many people that I've met over the course of my life that when they describe like what they're dealing with, I'm like, I don't know why I feel like you might have trait or you might have disease, but you're unaware. Home country wise in Nigeria, oftentimes, this is sad, but even when they do newborn screenings, the reagent is often expired. And so some people will get like AA, and then it's not until they take a trip to the, US or UK or wherever part in the world they're going to, and then they fall ill or require blood transfusions that they will then check and say, oh, you actually have sickle cell. So there are just so many things that could happen as to why some people are diagnosed later in life. But Jenica, I wanted to ask this question to you. What is kind of the criteria for blood transfusions? Because I myself as a patient, I didn't tolerate hydroxyurea as well as my peers. There are some people I know, they were on hydroxyurea for like over 10 years, worked like a charm. And for me, I was on hydroxyurea for 12 years and I didn't see the results that my peers were experiencing. So would that be a cause for them to say, all right, we would then recommend you have a red cell exchange every X to X weeks?
So now it's recommended. So I was told, which I don't 100% from my own personal opinion agree with, everyone living with sickle cell in the UK should be on a form of treatment, full stop. So that either should be hydroxyurea or blood transfusions or exchanges. And there's no question. So if hydroxy didn't work for you, they would have put you on transfusions. And I'm not sure when this became like something that was just, I don't know when that decision was made. As much as my ears are to the ground, I don't know when that decision was made. And I don't entirely agree with it, because I think for some people like myself, even though I'll have crises at home that I can manage at home, I would probably be in hospital. I would have admissions. This is pre-COVID, maybe like 2 or 3 times a year. But I would always, I would know that if I could just have a blood transfusion like twice a year, I'd be fine.
Right.
Believe me, because it's I know when it's low, I know when it's dropping. It's always when the seasons change, when I start to get unwell, and I just need a top up and I'm fine. But unfortunately, they won't do that, because they just think, what's the point? And this is where I just feel like there's no they like to do this one size fits all. One person has it and it works for them, so everyone should be on something. And I just think everyone doesn't work like that. But I do think it's good now, especially because we have the machines. We're able to do the red cell exchange across the UK, as opposed to just in certain cities. So it's a lot better in terms of managing the iron overload and other complications, which was what I had, that just kind of put me off wanting to have any kind of blood treatments.
I wanted to switch gears a little bit because, Jen, you and I both have a connection to Jamaica. And I just learned that Jamaica is probably has one of the highest populations of sickle cell. Yeah. On the island. And that was very surprising. I know that you visit there quite often. What do you see in sickle cell research there on the island of Jamaica?
I think Jamaica is a country where they do the best with what they have. If they had the resources that we have in the UK, for example, or in the US, for example, let me tell you, this would probably be one of the best countries to be in to live with sickle cell, because for the little that they have and what they do, I think it's amazing. But I think the issue over here is perhaps the lack of education and awareness among the population of people, because sickle cell is so common, it's so well known, it's almost not as big a deal as I'd say we probably make it in the UK. It's just oh yeah, such and such has sickle cell. Oh yeah, them always sickly, them always in hospital. And it's just something that happens. And then you might go wrong, and then that's it. But I think with what the Sickle Cell Centre does at UE, which is, they try and push for accessibility to medication. So they got approved, I think it was in 2020 or early 2021, where if you are treated at the sickle cell unit, which is in Kingston, you can get your hydroxyurea. You're allowed to there's a list of medications that you can get subsided costs for, or even as close to next to nothing, as opposed to having to pay the full price in terms of pain meds, hydroxy and other things as well. So they've able to convince the country on a political level and access to healthcare level to try and get as much things accessible as possible. But they also don't, I would say, take advantage of what's not needed. For example, they don't have a huge blood bank and blood supply. So they wouldn't necessarily believe that blood transfusions are the best form of treatment for someone to have every 4 weeks, given the risks of receiving blood and the fact that they don't have a blood bank. That would be a last case, a last emergency kind of treatment for them. They would find things and other methods to do. And it's also very easy to make, I would say, maintenance over here. If you need fluids, maybe you can just go and get fluids, or maybe you can just get this, as opposed to in the UK, sometimes I feel like they wait for you to be really bad and then give you everything. So prevention is better than cure, I think is the saying that they go with. Not wide though. And I think that's where the education and awareness has to come, because they only have the specialized unit in Kingston. You've got other parishes where, we're looking at the social economic status of patients. You probably can't travel to the unit. You can't get seen by a specialist nurse. They try and do their best they can of going around the island, but ultimately there needs to be more across the island. So it's great in one place, and if you can get to that place, you're probably okay. But for so many people, it's not an option, and they're just trying to do the best they can.
I have people reaching out to me often on social media for just access and support. And I have a great contact in Jamaica. She used to work with Dr. Sargent, and now she works at the Kingston unit that you were talking about. But I hear that it's a commitment, because when you go there, that first appointment is an entire day's long. And again, if you have issues with transportation and it's already several hours away, even though there's so many benefits when you are connected to that clinic, it seems like access is still
is difficult. And I'd love to be able to change that. Again, it's just resources cost, if we can, they need more specialist units across the island. And then my ears are to the ground in the UK, where there's limited specialist units in the UK as well. And I'm like, we still have like, you know, a good amount. And there's like one in Jamaica. So yeah.
Question for you. Kingston is Jamaica's capital, so it makes sense that that's where the Sickle Cell Center would be. Abuja is the capital of Nigeria, but yeah, no. More than likely, if there was a Sickle Cell Center, it'd be in Lagos, because that's just the most populated city. But do you guys have community health workers who go to these different parishes and educate the local community as far as teaching patients, here's how you manage sickle cell disease, here are, you know, the medication requirements that we encourage you to have, but if you don't, then maybe we can make plans to get it to you? Are there community health workers who are designated, their designations is to go to all of these individual parishes and better educate community?
Yeah, so they do have a very good sickle cell education program, which was approved, and they were working with the health minister, as far as I'm aware, of trying to get this, you know, go across the island. And they did it in several parishes. But as, you know, they know, and as I know, sometimes these things need to be repeated and it needs to be done more, you know, so, which is why I say they do the best they can. But sometimes a little help would mean that this could be like island wide, and especially into the rural areas where, you know, just having a basic understanding of feeling the tummy, temperature checking, staying hydrated, that kind of stuff would go a long way. But they do have a very good education training program, which they do travel to different parts of the island and try and implement this in hospitals and other places where there'll be cases of sickle cell.
Sounds like a dream job for me. I'm already CHW.
I got spare room.
I would love to come.
So as far as patient support goes, Jenica, you are an active advocate. And by being in that position, you almost have direct access to information. But for a young sickle cell warrior, whether they be male or female, but for the sake of this conversation, let's use male warriors who aren't as vocal about having sickle cell disease, how do they find out treatment options? How do they find out what CBO to connect to so they can, you know, establish a community? Because I will be honest, I didn't establish a sickle cell community or see the needs for it till I was 28. So a lot later in life. And so I grew up, everyone I knew that had sickle cell has now passed. So all of my experiences were insular because I just assumed it's just happening to me. So for a warrior in the UK, how would they be able to establish a community behind them?
I think now it's completely different. And if anyone is struggling like that, I would just say, go to social media, search the hashtag, because I do really think that there are so many strong, powerful patient voices and advocates out there. They may not just be in the UK, but the UK has a lot of them. And I think where, you know, back in the day, probably 10 plus years ago, people would be looking for recommendations of charity organizations that they could reach out to, or someone to call, or like a mentoring service. Some of those organizations perhaps don't fit into that. They're very limited. So for example, in the UK, one might just serve a certain area. And if you fall out of that catchment in terms of their funding and what they're able to do, you wouldn't be able to access their services or access that support. So you may be recommended to another one who's maybe less active, or maybe they don't have a good group of patients that are around your age group. So I would recommend social media, that hands down. There's sickle cell awareness hashtag sickle cell education, or just hashtag sickle cell. And there you will find so many amazing patient voices and patient advocates, and every single one of them are willing to support. If you jump into someone's DMs on, so like, you know, I saw this and I'm struggling with this, if they don't help you, they will probably recommend you to someone that will. And I think as a group, as we grow, and for those of us that have been through the experience and have started to be more vocal online, we know what that feels like when someone doesn't know what to do or who to turn to or where that community is. And it's going to be a continuous thing. I always meet people that say they don't know. I'm the first person they've met with sickle cell, and I'm like, how? Because I know so many. So I think for every individual, there comes a time when you will want that. Like you said, for you, it wasn't until you was in your late 20s. For me, it was like when I was a teenager. There will come a time, but I think whenever you're ready, there will be some something or someone there. And I would just say take it from there. But definitely look online. I see so many people say, didn't know anyone, or I couldn't find anything that was there for me. And I'm like, they're there. We are here. We're trying to be more and more vocal. I think we're there.
And Jen, being on her holistic track, I feel like I've connected you with so many warriors, and you've just been an awesome support for them as well. So I think social media has so many benefits just from, I mean, we can leverage it to bridge disparities and fight the misinformation, but I think finding support for people who have navigated and walked a similar path, that's like an unspoken understanding for sickle cell warriors that I could never provide as a provider. So I've connected with so many warriors. All three of you I've connected with through social media before having the opportunity to come on your podcast. But I totally agree that there's such amazing and beautiful support, and it warms my heart, because with everything, the state of the world's right now, it's sometimes disheartening that it is beautiful to see people just willingly advocate and being a support for complete strangers, potentially on the other side of the country or continent.
So there's so many CBOs internationally, in UK and USA. Do you see a difference between the two? Can you like compare and contrast, or they're just equally the same?
I think the only difference would be, I think for every organization, right, you'll have your main goals or main aims. So for some, it might be working on changing policy. I'm a member of like the European Sickle Cell Federation, and we're heavily trying to, reduce the disparities, not just among the fact that sickle cell predominantly affects Black people, but in Europe, there's so many, white people that are impacted by sickle cell, and they're facing like the opposite of the stigma, where we're not believed or that we're in pain. They're not believed that they have sickle cell at all. Everyone has a different agenda, but I think ultimately we're all fighting for the same cause, because if you're trying to change policy, you're still going to have to raise awareness and educate people for them to see the importance in that. If you're trying to build a community or do like capacity building for patients on how they can become better advocates, again, it's still going to be similar in different countries. We might have different types of medication and different accesses to treatments and how, insurance, NHS, whatever. But ultimately, someone in the US could experience exactly the same complications that I've had in the UK. Treatment might be different, but when we're looking at sickle cell on a holistic level, the mental impacts, how that's affected friends, family, loved ones, and everyone around you, that's going to be the same. And a medical provider or healthcare professional probably can't relate to you on that level. So I think even though they might have bigger agendas, there are really so many similarities and ways in which we can work together and unite to kind of do more and reach more.
So you mentioned the mental impacts. What does the support system look like in the UK as far as?
It's becoming more requested, and I think that medical providers probably know that there's a need for it, but not every service or not every specialist center has the funds or resources to be able to provide a counselor or support worker or a psychologist or someone to speak to. So unfortunately, like in my experience, I think we had one for 6 months, and then we didn't because there was no funding, and then we had one for like a couple of weeks, and then she was off, and then so sometimes I feel like it can be worse as well, like either be consistent or not. So I think we then just fall into this realm of joining a list and becoming a number on a waiting list of someone who needs mental support. And I don't feel like sickle cell should be generalized. I think more importantly, as with someone who has a cancer diagnosis, you're like allocated someone that you can speak to and vent to. I think sickle cell should be the same. I can't remember. There's so many times where like I've gone into an appointment and probably I went in thinking, oh, it's just going to be a regular appointment, and I leave finding out that I need surgery or I can't travel or I've got this, and it's just so like blasé, and then go about your day. Like you just leave thinking like, what's the point? And not having, I think for providers, almost treating it as if because you have sickle cell, you should just be used to this and you should be able to handle it and you should just be able to manage the diagnosis and carry on. I think that's wrong. And although it's not every provider, but although it's not for them to provide that social support, I think sometimes there could be a bit more empathy among kind of healthcare professionals. If we can't have individual psychologists or people to speak to, then perhaps empathy is something that needs to be taught a little bit more, but it's hard. And I think that's where building your community of patients that are on a similar journey to you would help.
Maya and Jenica, thank you. Thank you for blessing us with not only your knowledge, but the space that you are taking up. Because it makes me proud to know that like a British Jamaican woman is thriving in Jamaica, but not only is that, she's understanding the different facets of treatment in the UK versus treatment on the island. And I think the length and breadth of your knowledge is truly going to impact how you choose to advocate. And Maya, thank you, because I think oftentimes in this space, I will say this, as warriors, we sometimes lead from a place of hurt. It's not because we mean to be that way, but it's because of our life experience. But thank you for still showing up for this community in the way that you have and contributing it to it, because I think what you are doing is saying we're not all alike. I know you have that experience, but we're not all alike. And I genuinely am here because I want this community to win. I might not be directly impacted, but there are some tropes that they feel like I understand them, because in my own personal life, I've kind of had to navigate those tropes as well. So thank you for the work you do. We're so grateful. Thank you for teaching me how to see healthcare providers in a different light.
What we're trying to say is, Maya, we used to give you the side eye. I gave you the side eye. Like, what is the motive here? Why do you care so much about sickle cell? And we feel that way because of all of the things that has happened to us within the community. And so I'm going to say here, there's no reason to give you the side eye. I'm going to continue to push and support you, keep liking and sharing your posts, because I know what you're doing is from a place of love. So thank you for what you do, because you don't have to support us, and you stuck your neck out there for us. And for that, I truly appreciate you. I no longer give you the side.
Than you realize, because there have been, it's very easy to hate somebody and say things when you're behind a screen. And it's been, self-healing has been wonderful. So make me feel like I don't have to defend myself, and my actions will defend that. So it means a lot to me. And hopefully people know that my intentions really are pure, and I'm just trying to fight the same cause as you and make that impact. Anybody who wants to side-eye me, then so be it. But I can't waste my energy defending myself. I got to continue pushing on, because why waste energy trying? Thank you.
You don't have to defend yourself. You don't have to defend yourself. Keep doing what you're doing. And thank you for doing what you're doing.
Thank you. You guys are awesome. So we could literally pour praises for you to the advocacy work. I think on this panel is amazing. And I think it's just the beginning. It's been an uphill battle for everyone. And I think us being able to unite as forces and realize we have power in our voices, we have power in our numbers. That's how we're going to get the greatest change. So I genuinely appreciate us coming together. I know this is just the first episode that we're going to get to do and collaborate on, and just really excited to see where all of our futures take us. And more importantly, the kind of impact that we're going to bring to this amazing warrior community.
Absolutely. Thank you guys for just the opportunity to collaborate, because it's like we said, it's all of us, we're doing this for everyone, for everywhere, for every country. Like, it's not just going to be a one size fits all, or one thing works and no space to nothing else. There's so much space. And I think the more we kind of take up those spaces together, as opposed to like, this is mine and this is yours. Listen, it's got to be a collaboration. It's going to be us as a collective. Like Maya says, unity, numbers, that's where the power is. And so I thank you guys so much for having us. And like, we can't wait to have you. It's going to be so amazing. So thank you.
Stay tuned, as we have another bonus episode of Through the Genes coming your way. Next up, we'll be joined by the co-host of the Mind the Gap podcast.
So deep in my own sort of like podcast listening, and I really enjoy naturally like talking to people and learning their life stories and how they overcame things. And, I feel like we can learn a lot from other people through the lessons they are learning. And that is around the time that Sione began her therapy journey, I believe.
Yeah, we naturally just share a lot between each other, and we thought, wouldn't it be great if we just opened up these conversations for the world, because we learn so much from each other. So there's always something to learn from everyone's conversations. And then we thought, what if we factor in specialists as well, who can help us navigate all the things that we're also talking about?
Don't forget to follow Sickle Cell Prodigy and Through the Pain Inc. for additional resources and initiative updates. Thank you for tuning in to this episode of Through the Genes.